My name is Dr. Joy Smith. I am a registered pharmacist in the state of Illinois, and I am so glad to be with you all tonight as a Wakanapreneur as well. So I'm just going to go ahead and share my screen in just a moment. Let me get all my stuff up. And everybody, let me know how you're feeling this evening. I know this snow has bogged us down, but we've had a wonderful warm day today. So hope you all were able to get out there and get some fresh air. So let me get all of my slides together for you. All right. Okay, so let's go ahead and share and get this party started, shall we? So as I described, I am Dr. Joy Smith. I am a pharmacist in the state of Illinois. I've been a pharmacist for about, it'll be 9 years this year, but I've been a pharmacist for about 9 years in multiple settings, outpatient, inpatient, retail. And as a pharmacist, I always knew that I was helping people, but I also wanted to know how to help them on the side of natural wellness and natural healing. So that led me to becoming an integrative nutrition health coach. It led me to getting my aromatherapy certification because I'm just fascinated by how plants can really just impact our health from a holistic perspective. I am a member of the International Society of Cannabis Pharmacists because as I started to learn more from Wakana, I'm like, let me find some other like-minded pharmacists who understand this healing power and are digging into the research and digging into the science behind why cannabis is such an amazing, amazing plant. And I'm also a Ruby dispensary owner at Wakana for Life. So just very, very excited to be a part of this movement and very, very excited to be educating you all this evening. So let's get right to it, shall we? So I'm trying to move all this stuff out the way. And as you come on, please put your comments in the chat about who invited you, who wanted to grace you with this information. If you are a business partner, please let us know. I'm going to try to move this little thing up here. I don't know if it will. Okay. So CBD is all the rage among patients, as you see in this graphic, and it's launching their physicians into uncharted territory. So it's not even physicians, not only physicians, it's nurses, it's pharmacists. I mean, as a pharmacist, when I first started learning about cannabis, I was like, oh no, I can't touch that because that's gonna mess with my license, it's gonna compromise my license, I can't do that. But what we're learning is that there is a major, major health benefit to this cannabis plant. So as our patients start to come in and ask us about CBD and how it might impact their health and their wellness, it's important that we have the information, that we're armed to be able to give educated responses, both from a drug interaction perspective and from a perspective of making sure that our patients are safe and if our patients are healthy. So Dr. Sanjay Gupta was an example of this. He was adamantly opposed to marijuana, adamantly opposed to the cannabis plant, and we don't have marijuana here at Wakana, but adamantly opposed to the cannabis plant in general. And that's what a lot of physicians don't know, and a lot of people don't know, is that cannabis is a family of plants. When people hear cannabis, they think weed, they think getting high, they think all kind of legalities, and that's not the only part of the plant that's available to us. So Sanjay Gupta actually had to come out and give a public apology and say, hey, I didn't dig deep enough. I didn't do the research enough. I didn't really go into the science behind what this cannabis plant can do. So once he made that public apology, he started to then do his research, and he found the same things that we're finding about how amazing this cannabis plant is. So for those of you who don't know, in our healthcare professional setting, the human, I'm going to minimize my screen a little bit so you all can see. The human endocannabinoid system is an amazing system. Every being with a spinal cord has an endocannabinoid system. And our endocannabinoid system is full of receptors that are attached to a lot of places in our body, our heart, our eyes, our immune system, our kidneys, our liver, just having receptors that are looking for cannabis to bring the body back in balance. So there are tons of peer-reviewed articles as to how this endocannabinoid system actually works, tons of peer-reviewed articles on how cannabis is impacting a lot of different disease states. But it's just important that you do your due diligence and do your research, your favorite search engines, PubMed, different scholarly articles that can really speak to this now that cannabis can be studied. And there's differences between hemp and marijuana. So when we hear cannabis, automatically we go to the marijuana side. But there's a family of plants. So picture there are two different species, right? There's a hemp species. That's where the CBD oil from Wakanda comes from. And it's legal because there's less than 0.3% of THC in our products, right? Marijuana is going to contain about 15 to 20% of THC, and it's also going to create that high. Okay, so there are distinct differences between hemp and marijuana, and you're noticing a lot more of the health benefits in the hemp species from dealing with all of those different receptors that we were talking about, the CB1 and CB2 receptors, dealing with all of those receptors and impacting change from a holistic standpoint in a healthy, natural, and organic way. So you may be wondering, okay, my patients are going to be coming to me, but why are they seeking CBD? What are the major reasons? We know that anxiety, depression, and pain are some of those major reasons why people are seeking CBD. And it's important that we understand what the science is behind it. What is the research? What are the statistics, right? So as a healthcare professional, that's what I would want to know. When I'm learning about any new thing or new drug or what have you, I want to know what the science is behind it. So again, I'm going to minimize so you all can see. Chronic pain is the #1 cause of disability and disease burden globally. We talked about why people are seeking out CBD, and chronic pain is one of those reasons. Anxiety disorders, people 18.1% of the population, 18 years and older. Those people are complaining of anxiety disorders, making it the most common mental illness in the US. And then we're talking about depression. So about 6.7% of American adults have had at least one major depressive episode in a given year. And we know that that is increasing given COVID-19. So the Journal of American Medical Association brought up an article about the prevalence of depression symptoms in the US before and during the COVID-19 pandemic. And what we're seeing is that the prevalence of depression symptoms in the US was more than 3-fold higher during the COVID-19 pandemic as compared with before the pandemic, which makes sense. People are losing their jobs. People are losing family members. People are losing just control of their normal day-to-day. And it's saying that individuals with lower social economic resources are the ones that are most stressed. So that makes sense to me because I work with individuals with lower social economic resources. Working at the county hospital, we're dealing with people from all walks of life, but primarily people who don't have access and who have to come to the county hospital because of, regardless of ability to pay. They're reporting a greater burden of depression symptoms. So if you work in the inner city areas, wherever you are as a healthcare professional, that makes sense to you because you see those patients on a regular basis. So the doctors that we may interact, the healthcare professionals that we may interact with may want to know this. We have all these holistic options, but okay, that's nice. Are there drug-drug interactions between CBD and prescription medications? And so again, going with the science and going with the research, we can go and talk about our major CYP450 enzymes. Our healthcare professionals on the line know that these 6 enzymes metabolize about 90% of the drugs that our patients are taking, right? And if you're a guest on the line, just know that these CYP450 enzymes are designed to break down medications or break down substances that come into the body that have to be metabolized or broken down, right? So a little bit about CBD metabolism. The substrate, CBD is a substrate of the enzymes 2C19 and 3A4, and it inhibits enzymes 2C9, 2D6, and 3A4. So there is a potential for your CBD to interact with the medications that your patients are taking, but the reason that they don't have to, and the reason that CBD can be safely taken with prescription medications is our spacing rule. We know that we can space out medications 2 to 4 hours from the time that we're taking our CBD, and therefore that CBD is not traveling down those same enzymatic pathways at the same time. Therefore, we greatly decrease, if at all, having any interactions between the medications and the CBD. And, you know, it just really baffles my mind. There's a lot of medications that our patients are taking, medications that interact with CBD. And while this may feel like an exhaustive list, if we can be honest, some of these medications and some medications that our patients are taking already interact with one another. But what have we done? We've spaced them out so that the patients can get the benefits of those medications at different times and not have interactions. Similarly, our patients can get the benefit of CBD and their prescription medications with no interactions. Just because I am a pharmacist that advocates for natural remedies and natural ways of healing does not mean that I want patients to stop taking their medications abruptly, particularly anxiety medications, depression medications, any type of antipsychotic medications, because there can be detrimental effects for you just stopping your medication cold turkey. That's not what we're looking at. All of these prescription medications in particular are very common in the patients that I work with. So medications for hyperlipidemia, hypertension, heart complications, blood thinners, asthma and allergy, diabetes. I mean, the list goes on and on and on. But there are studies to show that these medications can definitely work that CBD can definitely work for some of these conditions, decreasing those symptoms, making sure that the patients are experiencing relief. We're not claiming cure. We're not claiming that any of these CBD products treat or anything, but we are saying that there is some symptomatic relief that can occur. So as a healthcare professional, you probably also want to know who's using alternative medicine. What are the trends? What is going to make this make sense for my patients? And so if you look at the treatment trends here, you'll see that for global complementary and alternative medicine, there are different trends, and we're going to specifically focus on the botanicals at the bottom. And botanicals, as we know, are plant-based options that have medicinal benefits. So if we're talking about essential oils, if we're talking about CBD, those are considered botanicals because they come from a plant, but they have medicinal properties that can really affect change in patients. So with this blue color at the bottom, you're seeing that from 2014 to 2025, there's been a constant increase in the amount of people that are using the botanical modality in terms of healing and in terms of natural wellness. Now you see acupuncture there, you see that that's increasing, mind, body, yoga, magnetic intervention, different types of things that people are using. But the drive home point is people are now starting to get into that natural wellness space. They're now starting to understand that there are herbs and different plants that have medicinal properties that can address some of the symptoms that they've been experiencing. So speaking of essential oils, what are those? I told you all that I am a certified aromatherapist, so I really understand both the drug interaction part and both how drugs are able to help patients with certain conditions, but I also understand how essential oils, CBD, different botanicals are able to help patients with those same conditions. And they're all backed by science. So what are essential oils? They're highly concentrated aromatic extracts that are either distilled or expressed from a variety of plant material, including flowers, leaves, grasses, roots, seeds. I mean, the list goes on and on in terms of where we can extract these oils from. And essential oils can also be used to help relieve pain, reduce stress, improve mood. And there are a lot of other different use cases for essential oils that are able to really help patients when they're needing symptomatic relief. So you may be wondering why I have this weird picture here, right? And so this is a picture of a doctor back during the times when the bubonic plague was going on. And they wore these robes and these masks because if they're going to care for the patients, they don't want that highly contagious plague to, affect them. And so one of the things that they did is that they doused themselves in a particular oil blend. Sometimes it's called Thieves Blend. At other places with Wakana, it's called Essential Defense. But the reason that it's called Thieves Blend is this. When the bubonic plague was going on, it was almost impossible for anybody to be able to go into a space where someone had the plague and not contract it themselves and eventually pass away. So you had these thieves that were going into people's homes, going into the areas where the dead were, and were basically just stealing all of their stuff. But they continued to steal, which means that they didn't contract the plague. And so when they got caught, the judge was like, look, if you can explain to me why you didn't get caught while you were stealing from these people that obviously had the plague, then I'll let you go, because then it's going to help a bunch more people. So what they said was, okay, we're perfume and spice merchants. We identified a blend that we knew was going to protect us from sickness, and we put it all over our bodies, our temples, our ears, our feet. We doused ourselves in this blend, and it allowed us to keep stealing and keep getting the things that we needed because we were out of money. Nobody was buying from us. allowed us to keep getting the things that we needed without getting sick. And so that blend was then doused on the coats and the masks of the doctors that were going to care for people. So that wasn't the right intention in terms of stealing from people, but it does speak to the power and the longevity of how essential oils and plant-based oils have been used. So it's just an amazing, amazing story that continues to repeat itself. And when we're talking about essential oils, just talking about how it impacts your body once you inhale the essential oils. Once the aromatic substance, whether it's coming from a diffuser or you're rubbing the essential oil in your hand and inhaling, it goes through the olfactory neurons and reaches the limbic system of the brain that's in charge of emotion, in charge of mood, in charge of whether you feel tired or uplifted or what have you. And the brain is so intricate and so important. There's multiple parts, the hippocampus, the amygdala, that really deal with that memory and that mood piece. So when you have a smell of a meal, or when you have a smell of a cologne or a perfume from a loved one that you may remember, it's going to trigger that memory. Your brain is working together with your olfactory neurons and all those pieces to really bring that memory back to you. So it's just amazing how the brain works. And that's just what happens when you inhale the essential oil. You can put the essential oil on an area of pain as long as you're using a carrier oil and really get that local relief. You can diffuse the essential oil and really take care of those airborne microbes that might be scurrying about in the air. There are just so many options, and essential oils have been around for so long to the point that our drugs are really the new kids on the block. Those are the ones that have been synthetically created. Those are the ones that are fashioning their uses off of the plant-based materials that we've had for years. So just amazing, amazing stuff. Even the Asian Pacific Journal of Tropical Biomedicine says once the oils are in the system, they remodulate themselves and work in a friendly manner at the site of malfunction or the problem area, right? And this type of therapy utilizes many permutations and combinations to get relief from numerous ailments. You're talking about depression, indigestion, headache, insomnia. The list goes on. And what's important to understand is that essential oils are found to be more beneficial when other aspects of life are given consideration. You can't just bring essential oils into a space where there's fried food every day, where there's just an imbalance. Essential oils are going to work to be complementary. They're not going to come in and fix all the problems. You also have to make sure your diet is given due consideration. It's much harder for an essential oil or any type of volatile molecule to get into that space and really affect change quickly. And your diet is trash, or the lifestyle is not one that is going to be willing to accept the essential oils in its use. So just amazing, amazing information about how essential oils and botanicals in general are able to affect change. This particular chart is really talking about the chemical constituents that are in essential oils and which essential oils kind of fall into those categories. So if we're talking about, let's see, monoterpene alcohols, that's one of the chemical constituents. It's an antiseptic, it's an antiviral, it stimulates the immune system. So we may be talking about tea tree or peppermints or eucalyptus. There are different oils that fall into these different categories. And if you need an email of this chart, I can certainly send it to you. But there are different oils that fall into different categories and they have different use cases, which makes it amazing for you to be able to use these in symptomatic relief. I mean, we're talking about, for instance, the esters, antifungal. So lavender helps with that. Geranium helps with that. There are so many use cases for these essential oils other than smelling good. And we just have yet to scratch the surface, especially with the studies that are being done. So some essential oil safety considerations. We don't want to apply to open wounds. I know you may be tempted if you're using it for pain. Don't apply to open wounds. Let that wound heal up and maybe apply around the wound so that you can address any swelling. And same for CBD. So you can address any swelling or any scarring that may be occurring around the wound. But wait till it closes up before you're deciding to apply it on site. Keeping away from the eyes and washing hands after use. I can speak from personal experience. When I was first learning about essential oils, I got some in my eye and tried to use water. Not a good idea, because what do we know? Water and oil do not mix. So if water and oil don't mix, don't put water in your eye when you've got an oil there. Grab your carrier oil, slap it on. You may be a little greasy, but at least that burning will stop. When you're using essential oils, making sure that you patch test a small area, seeing if you're sensitive to that particular oil. Doesn't mean that it's poisonous, doesn't mean that it's hurting you. People have different sensitivities, and you want to make sure that you either dilute your essential oils with a carrier oil. And when I say carrier, one that you can add with it to make the effect of the oil on your skin less dramatic. So if it's a hot oil like peppermint or cinnamon or what have you, you add that carrier oil just to make sure that that hot sensation doesn't come. Reading warnings and speaking with a certified aromatherapist and speaking with your doctor, even if your doctor doesn't know about essential oils, clue them in on what's going on. Because what we know is that some of these botanicals can have some of the same actions as some of our medications. So for that reason, you want to read warnings. If you're pregnant, nursing, have serious medical conditions, always loop your doctor into what you're doing. And a 2 to 3 hour space between medications and essential oils, or medications and CBD. Just making sure that if those actions do overlap and you do not have the knowledge right then, at least you know you've spaced it out so that that metabolism won't be occurring at the same time, particularly if it's an oil that's safe to ingest. More is not better. Essential oils and plant-based healing, whether it's in an oil form or what have you, are extremely volatile molecules that once they go through the body, they don't need a whole lot to affect a whole lot of change. So start low, start slow, and increase your dilution or increase your titration as you go along. And diffusing. So we know that diffusing, for instance, lavender or peppermint in certain high stress situations in hospitals can help to bring that down, bring that stress down. We know that diffusing peppermint in, say, an oncology person's room can really help with that nausea and really help with that nauseated feeling. So just diffuse 30 minutes at a time as not to overwhelm the senses. And then you can come back and either have the person exit the room and come back, or turn it off and turn it back on later. Those are options so that you're not diffusing more than 30 minutes at a time. So with that being said, I am going to stop sharing my screen. I see that we have some new people on, and Dr. Sylvester is in, Kathy Weathersby is in. I'm going to see if any of our other presenters are here. Robin Tillman, she was going to come up and give some information that she has. She's been a high-risk maternity nurse for probably the last 13 years, correct me if I'm wrong, Robin, but that is her expertise. So I wanted to give her an opportunity to jump in, and then some of our medical advisory board, if you'd like to speak after Robin is done, we more than welcome you. So Robin, you can take it away whenever you get ready.
Okay, I see mute. I don't know if there's a place for my camera. So little tech issues here.
Oh, it's okay. Well, we can hear you great, so that works for us.
Okay. Yeah, I guess there's not an option for my camera because the way you have your screen set up.
Oh, it's not letting you share? Okay, hold on. All panelists. Yeah, it's available for you to share. I don't know why it's not letting you. It's not letting you share your screen.
I mean, usually you can see the other participants.
Mm-hmm.
You know, you can go to the top and see like view if it's gallery or speaker view.
Mm-hmm.
And yeah, that's not showing up on my screen.
Oh, okay. Well, if you share your screen, if you have slides you want to share, if you just have a story that you like to give us in terms of your experience with the CBD.
Yeah, it's not giving me that option. All I can see at the bottom is chat and raise hand. So it's like I'm a participant rather than a panel.
Okay, let me see. Kathy, are you able to?
Yeah, I just promoted her.
You did? Okay.
She should be back in now as a panelist.
Got it. Okay, yeah, Robin, you're a panelist now, so you should be good.
Okay, yeah, I can see it now. All right, terrific.
Thank you, Kathy.
I'm still having some technological fun with these Zooms and everything.
I truly understand.
Oh, okay. Hello, everybody.
Hey, Robin.
So let's see. I was able to actually get my slides up from our last conference. So, but it was probably about a 10 to 15 minutes presentation. I don't know if we have time for the slides and everything, or do we just want to do like an overview of women's health and CBD?
Oh, yeah.
I mean, what do we have time for tonight?
Whatever you are able to share, we are willing to glean the information. We have about 30 minutes left on this call, so we certainly don't want to take it up until that point.
Right.
But if you'd like to share your slides, or if you just like to talk from your slides, whatever is most convenient for you.
Okay. All right. Well, here, let me see if I can pull them up here. I'll share my screen. And, now, do you think it'll show up better if I just click on the open screen with the slides on there, or share my screen with all the participants?
You would have to share it for everybody to see it.
Okay, thanks everybody for being patient here. Technology is not my forte, but I am trying to get better.
That is all right. It's all about learning.
Okay, can you see the slides, the CBD and women's health?
Yep, I can see them and I can hear you clearly.
And you can hear? Okay, great, because I don't have my share sound, but be sure that's on there.
And welcome all of our guests, our business partners. We are so glad to have you and that you're here learning with us. So just continue to learn as Robin gives us her knowledge.
All right, everyone, like she just introduced me. Thank you for that. I'm Robin Tillman. I'm a registered nurse for over 20 years. My last fields of expertise was high-risk maternity. I worked at Rush Hospital for 13 years there. I now run a social club, and that's what I do full time, but I love working with Wakana and being able to use my medical knowledge to help people. So I was really interested in how CBD can help, women's health issues. We know that it can help a variety of other things, debilitating issues that we hear about, Parkinson's, schizophrenia, PTSD, but a lot of the debilitating diseases or conditions that women have, often prescription drugs and over-the-counter drugs don't really offer much help. So, or they have a lot of really bad side effects that people would rather not deal with. So if there's some other ways that we can help, to treat those symptoms without using dangerous over-the-counter drugs or dangerous prescription drugs, then it's really nice to have options like that. Now, we already have evidence that it does help things like these other conditions, epilepsy, Parkinson's, schizophrenia, like I said, but CBD can also provide relief from a number of other specific women's issues, such as premenstrual syndrome and menstrual cramps. PMS is a condition that occurs in women from 2 to 14 days before the onset of their menstruation. And the majority of women suffer from some form of PMS, which can range from digestion problems or irritability, mood swings, headaches, acne, sometimes just crippling, painful cramps during their period. A lot of people have been taking Midol or Motrin or other NSAIDs, and that can give temporary relief from the menstrual pain, but it can also cause complications like GI bleeds or ulcers, tinnitus, headaches, liver and kidney problems, stroke, and even death. So the use of CBD can help relax these uterine muscles and reduce the pain and the cramping and gas and other PMS symptoms like moodiness and irritability, and it does this by restoring serotonin levels. Perimenopause and menopause can also be helped from CBD. Menopause or premenopause can be a difficult time of life for women during their 40s and early 50s. And these symptoms can include hot flashes, night sweats, insomnia, heart palpitations, moodiness, anxiety, depression, loss of libido, vaginal dryness, joint pain, weight gain, hair loss. The whole gamut of things that we would really like to not experience if we can help it. And these issues are usually a result of a loss of estrogen. This is what really got me interested in CBD myself. I was having a lot of these symptoms not long after my 50th birthday a couple of years ago, and a friend told me that CBD might help. I was up all night with just sweats, and I'd have to be like taking clothes off in the winter. I'd have to wear a short sleeve top or a tank top all the time and take the jacket off or the sweater off because I would just start breaking out in a sweat. And running a social club and trying to look professional during events, this was not good. And And so I was just wondering what might possibly help this. Getting on estrogen could, but then that carries a risk of breast cancer. And so I was, concerned about that. So when I tried CBD and found that it really did help me, using it on a daily basis, after a month, I noticed a huge difference and the hot flashes went away. So that was really great, fantastic for me. I was really, really happy that I found something natural that worked and wasn't dangerous. Now, phytoestrogens that's found in CBD and other cannabinoids can help supplement the loss of estrogen that causes these symptoms and takes place during the perimenopause and menopause. Anandamide is a neurotransmitter that's found in cannabinoids, and this regulates body temperature, so that helps with the hot flashes. CBD helps maintain these healthy anandamide levels, and if you take the CBD that's combined with even a small dosage of THC, then the hot flashes can be greatly reduced, and I can attest to that. Another condition that women might have is endometriosis. And endometriosis is when tissue that normally grows in the walls of the uterus or the endometrium breaks off and grows elsewhere in the body. This broken tissue will eventually cause irritation of surrounding tissue, resulting in uterine scars, ovarian cysts, and even fuse the surrounding body tissue. An imbalance in the hormone estrogen has been linked as a possible cause to endometriosis. My sister, in fact, suffered from this and had to have a hysterectomy, and she was in a lot of pain for many years before having that surgery. So I wish I'd been able to introduce her to CBD at that time and see if that might have helped her. And some women do report minimal discomfort with endometriosis, but there are also many women that have extreme pain, cysts, emotional afflictions, severe headaches, hair loss or excess hair growth in unfavorable areas, weight gain, abnormal periods, and acne. And I saw a lot of these symptoms, like I said, with my own sister. Now, there is no known cure for endometriosis. The condition usually goes away at menopause, but in some cases, surgical removal of the endometrial tissue is required. My sister actually had it all around her uterus and actually like on her appendix and surrounding in her intestines. It was everywhere. It can be really a wicked condition. Many prescription medications come with significant short and long-term side effects, but a substantial number of women have found that CBD is very effective in treating their symptoms of endometriosis. CBD directly affects hormone production, and since the endocannabinoid system is all about utilizing CBD to maintain balance, it can also help stabilize those hormonal inconsistencies as well as help with pain. 500,000 women each year experience some form of depression brought on by the arrival of a new baby. Postpartum depression, or PPD, and its milder, shorter-lived form dubbed as the baby blues, induce symptoms of anxiety, depression, overwhelming fatigue, and loss of appetite. A disconnect from the baby at the time when bonding is crucial is experienced by PPD mothers. Extreme cases of PPD can provoke hallucinations and cause the mother to have thoughts of harming the baby and her other children and herself. CBD may also boost and balance serotonin levels in the brain and regulate energy levels, sleep patterns, and restore a healthy appetite. So this can really go a long way towards making it easier for the new mom to care for the baby. CBD may also be incorporated into a treatment plan for PPD alongside with psychotherapy, exercise, and medications. Pharmaceutical prescription for PPD might take up to 2 weeks before any improvement is evident, but the positive effects and reduction in anxiety from a dose of CBD are almost immediate. It is important to keep in mind that whatever supplements or medications that the mother takes, it will pass through the breast milk. And many medications for PPD are not recommended for breastfeeding mothers, and the effects of CBD in newborns and infants are still not known. But a healthcare professional can help new mothers find the best possible solution. And our Dr. Rita, being an OB nurse, she can provide a lot of helpful information on what might be safe or what breastfeeding mothers may need to watch out for. Breast cancer is another condition. Although mortality rates from breast cancer are declining, 1 in 4 women are affected worldwide. Some of the most well-researched and abundant studies as it relates to cannabinoids and cancer research, specifically breast cancer. There have been recent breakthroughs, notably an Israeli study that suggests CBD can block and reverse the ID1 gene, and that's the gene that's responsible for spreading and migration of cancerous cells in the metastatic breast cancer. Another study found that cannabinoids may result in not only a reduction of tumor size, but also cause cell death in cancerous cells. When cannabinoids or CBD are used in conjunction with other cancer treatments like chemotherapy, the brutal side effects can be less severe and more manageable. Cannabinoids may also assist in cell regeneration and maintain the balance of healthy cells, restore energy levels and sleep balance, and counteract the feelings of nausea that's associated with chemotherapy. And with the endocannabinoid system largely influences hormone production, and CBD, along with the endocannabinoid system, keeps all these different hormones in check. Now, men and women produce certain hormones at different ratios and have differences in muscle mass and fat distribution. So it is much easier to understand why cannabinoids affect men and women differently. Interestingly enough, though, the majority of CBD users are women. So have a conversation with your doctor to determine if CBD supplements might help you and maybe help treat any of your personal women's health issues. So thank you for that.
Sorry about that. I was having some technical difficulties too. I couldn't unmute. Thank you so much, Robin. I really appreciate you coming on and sharing your expertise, because I myself, even though I am a woman, I am not a woman's health expert in the way that you are. So thank you so much.
Oh, it's my pleasure. Thank you.
If you don't mind, I know you spoke a little bit about why you were excited to be a part of Wakana and using your health experience to help people, but what was your turning point? What made you say, I want to try this for myself and provide this information to my patients, to my family members? What was your turning point?
Well, when I first started having hot flashes and experiencing all of these conditions and problems from premenopause myself, and couldn't find anything that would help me get a good night's sleep, manage anxiety and depression, headaches I was having. I noticed my hair was thinning too. And the only option that my doctor gave me was to get on hormone replacement or estrogen therapies, and I had read that did increase a woman's chance of getting breast cancer. And so, I really didn't want to get into that if I didn't have to, if I could find a natural alternative. And so another doctor I had worked with, Catherine Wilburn at Rush Hospital, who's an OB doctor too, she told me that CBD had been helping a lot of women and that she was, a distributor for Wakana herself. So I bought a bottle from her and I used it, for about a month. I just was thinking, well, maybe it'll help bring me back in balance and maybe, it'll help a little bit. But I was amazed that after taking the tincture twice a day for, after about a month, the hot flashes stopped completely. I was able to get a good night's sleep. I was on a much more even keel as far as emotional anxiety or feeling kind of depressed or blue. I could just definitely tell a difference. And, being able to sleep through the night without waking up to kick off covers or pull off pajamas, or being out at the Thanksgiving and Christmas parties and having to strip down to a tank top, and people are like, what's wrong with you? Or breaking out in a sweat.
Right.
I felt like I was a slave to this medical condition here. It's like, there's got to be something that can be done about it. Mm-hmm. And so, yeah, the CBD really helped. And I was impressed that all the ingredients are organic and non-GMO, and had a panel of health experts on the board and who backed it up and were also involved. And so that helped me to know that it was a good quality product that I could recommend to other people and feel safe using.
Amazing. That's great. I'm really glad you got to get on with us this evening. Our medical advisory board is always willing to give information about CBD and how it not only impacts us, but impacts our family members, our friends, our patients. It's just amazing stuff. I'm so excited. If we have any guests that have any questions, feel free to put them in the chat and we can address those questions. Wayne Pleasant said, that was a great testimony, Robin. Thanks. It really was. You are my testimony for menopause all the time. So just know if somebody said, well, I heard Robin. Yep. Dr. Joy told you, or Wayne Pleasant told you.
Yeah, if it's not your time now, it will be one day. So, and actually, if you get on CBD and start taking it consistently, maybe you can avoid the year of hot flashes that I had to endure before I found out about CBD. Just if you can make a smooth transition into the next phase of life, then that'll really help you to stay on course as well.
Yeah, absolutely. I was impressed by the sheer quality and the products that we're able to use. I had times where I wasn't able to sleep during the evenings. My cycle, we're talking about women's health, my cycle is historically awful in terms of pain. But I notice now that as the cycle comes up, I almost forget because I take my CBD so consistently that the pain is not as excruciating as it was before. So it just really speaks to the quality of the product and the fact that they actually do work. um, and does any of our other medical advisory board members have any input or anything that they want to share in terms of how CBD may have impacted them or patients that they may be
Hi,
working with?
Dr. Joy. Hi,
Yes.
this is Dr. Sylvester and Robin and Dr. Joy. I just want to say I appreciated the information that you both gave, and I'm a mental health therapist, and I would like to add that just listening to your presentation, Dr. Joy, it was really interesting, and I came as I might be a panelist, but I'm also a business partner.
Mhm.
And as I talk with my partners and as I talk with individuals that I work with, it's so interesting to be able to share about Wakana because it is organic, it is safe, and learning more about CBD. This is a wealth of experience for me, but it's also a new learning for me because the doctors have already admitted, and I think Dr. Rita has talked about how when she was in med school, they didn't talk about the endocannabinoid system. Dr. Oz talked about that. He didn't know about it. So we're learning, and this learning is ongoing. I'm really appreciative of the doctor's addition and to be a part of this advisory panel, because not only do I learn from each of your disciplines, but it also enhances my discipline. And I really appreciate that. And I'd like to speak about people that may not be doctors. I want to talk to them for just a half a second, if you don't mind, real quick. All right. It's okay that you may not be in the medical field, but we're here to educate you on information that you can share because it's backed in fact, and it's backed with experience, and it's backed with our own testimonials as well. So you can talk to individuals and feel sure that you are giving some factual information. And if you don't have to know all this stuff, direct them to the doctor's advisory, this particular edition, and they will be able to hear what others hear. Each one of us have a different discipline. Kathy Weatherby has her discipline. Robin has hers, women's health. That's wonderful. And even pieces of it. I have mental health. I'd love to share in that aspect, in that realm. And of course, you, Dr. Joy, not only are you a pharmacist, but also an aromatherapist. And we have others with other of the doctors that are on the advisory board that have different disciplines that they can tell the advantages of CBD. And it just goes on and on and on. And it just gets, as we used to say years ago, it gets gooder and gooder as you share this information. And so we're learning. And so I don't know about anybody else, but I take copious notes and I try to listen every time any of the doctors speak. I have a client right now that suffers with endometriosis. Interesting to hear, Robin, that there is no cure for it. I mean, really, every month, it's just painful. It's debilitating. She can't go to work. She can't stand up. She's just bedridden, and it's just painful. And no Midol and no Motrin or anything is going to help her. So being able to share now about CBD, I can tell her what tinctures or that she could take, or what essential oils she may be able to take. So this is good learning for all of us that are on the line, not just me, but every listener, and you don't have to be in the medical field to partake of this particular information. Thank you so much for allowing me to speak.
No problem, no problem at all. I mean, I think we're all learning as healthcare professionals, because CBD, as I explained in the beginning, is uncharted territory for a lot of healthcare professionals, a lot of doctors. You know, those that have not come over to the natural holistic side like we have, they still have questions, and we still are here to provide the information and provide the research and the knowledge and point them in the right direction of some knowledge. So we have a couple of questions. Some of them may need to be emailed, but for Christine, she's asking which of the CBD products was used to help with hot flashes. So Robin, you can speak to the ones that you were using.
Well, me personally, we recommend everyone like start low and go slow, because you don't know how CBD or THC is going to affect you. The Power Hembranium worked very well for me. There's only less than 0.3% THC in there. But, you know, you do want to start at a low level because it could tend to make you sleepy or make you feel a little bit funny. So it's recommended to start with 3 drops twice a day. Now, I did that, and each week I gradually moved up a bit because to manage my symptoms, I just needed a little bit more. So I found between 5 and 7 drops twice a day, in the morning and in the evening. And I would take a gummy at night to help me sleep, and that would get me through the night and, you know, keep the hot flashes away. And, you know, I noticed they went away after a month. And then there was a point where a couple of months later, I stopped taking it just to, you know, see if that was really it, or maybe I was just done with these menopause symptoms. No, sorry. So yeah, within a week or so, the hot flashes were back. I was up during the night kicking off covers and pulling off clothes. I'm like, okay, no, let me just stay on this CBD, even if it means I might have to skip a night out, a partying, or that bottle of wine. If I got to choose, I'm going to get my CBD tincture so that I'm straight.
Right.
Actually, I find I drink less wine when I'm taking the CBD because I'm so relaxed. I don't even need as much alcohol. So, and then, you know, if you're having like joint pain, which sometimes people get, the Dr. Rita's rub or the pain cream that we have works really well, the power cream. Some women have told me they use that on their abdomen for their menstrual cramps. Just rub it on there and maybe put like a hot pack on top, and that helps it absorb and they feel relief that way. If you're having issues with vaginal dryness, we have CBD lube. And so we have 2 different kinds now. So there's just all kinds of ways you can incorporate CBD to help you with issues that you might be experiencing. Even the hair thinning, I noticed a patch like on my temple here, the hemp-powered hair. I put that on there since December, and I've noticed new growth in that spot. I mean, it's still kind of short because only a couple of months, but at least it is filling in. So, you know, the loss of estrogen or the loss of those nutrients that our bodies just tend to lose when we get older, CBD and then the essential oils that, you know, we have in the products can really help to balance our bodies so that we can combat some of those negative conditions and things that occur.
Absolutely. I don't think anybody else can answer women's health questions the way that you do, Robin. So I really, really appreciate it.
Thank you.
I'm going to kind of go backwards here. I have a client who has Parkinson's. Can anyone speak to this condition? What I like to do and how I like to address these things is if Dr. Rita has already done a presentation on it, I always defer to the YouTube videos that she provides. Not because I don't want to help, but because I want to let the experts speak. And I have no problem with saying that that is not my expertise. So what I am doing, I think that's Wayne Pleasant, I am attaching the YouTube link in the comments. So anybody else that wants to look at it, Dr. Rita has a YouTube series full of videos for different disease states, different ailments that people may be dealing with and how CBD can help. So I did attach that, no problem. I did attach that there, and that way you can copy and paste it and view it at your leisure. And that way she breaks down the disease state, she breaks down how the CBD products can help, what she recommends, how it affects different symptoms. So I think that that would be very, very helpful for you. My son is on dialysis. What products will help him with the after effects in his sore arm at the point of the needles? So Robin spoke to the topical products. And I think that those could be really helpful for his dialysis in terms of the point of the needles and that soreness that's gonna happen, not directly on the injection site, but around that area. Of course, we have to know like what medications he's on and how to see if it's interacting with his medications from a internal standpoint, like if he's taking a tincture or a gummy or what have you. But I know that for the pain in the injection site or around the injection site, that topical can be very, very helpful. Let's see, Zeb, about thyroid. Okay, what can any of you tell me about thyroid? Because I had thyroid cancer and I'm assuming levothyroxine for the rest of my life, and the medication is going to cause osteoporosis. So I cannot give you an educated response to what can happen. All I can say is that we can look, if you want to email me personally and give me a list of your medications, what I can do is do an interaction check just to see if those medications interact with CBD. If they do, you can just space them out about 2 to 4 hours from the time that you take your medication and your CBD so that they don't go down the same enzymatic pathway that we talked about. And I will see if we have any videos or any type of education around the osteoporosis piece and the thyroid piece. If not, that can be something that we can recommend to Dr. Rita to do on a Wednesday call, because she's always looking for new topics to talk to people about, because she wants to hear from the people to know exactly what the people want to know. So Zeb, if you can, I am going to put my email address. If you can send me an email with a list of your medications and also specific questions that you'd like me to pass along to Dr. Rita or specific topics, I will definitely do that. So it's yourcbdpharmd@gmail.com.
Also, Dr. Joy, I have Hashimoto's thyroiditis.
Mm-hmm.
And I don't know if you're familiar with Hashimoto's. And I don't do the levothyroxine. I do a natural organic blend that my naturopath has prepared for me.
Mm-hmm.
And I also take CBD. Dr. Rita did a series, I'm sorry, she did a presentation on thyroid conditions. So that might be on that YouTube.
Oh, cool. Let me see if I can find it real quick.
Yeah, I think I remember her doing one because I was particularly interested in that one back, I think it was in 2019.
Got it. Okay. Let me just search real quick while I'm looking at, we're looking at tinnitus and CBD, or ringing in the ears. I will look that one up as well. So please, for general medication for partners. Okay, Nikisha, can you clarify your question? Do you have a list already developed for general medication for partners? If not, can we work on that? What do you mean by a list for general medication for partners? Oh, medication interactions. We don't, but that's a great idea. Typically, I'll run an interaction check if anybody has any ones that they want to send me specifically, but I think that that could be helpful. Okay, thank you, Jewel. Put that remedy in email for me regarding dialysis. Well, we thank you all for coming on this evening. I want to make sure that I have all the questions that need to be asked. And I'm going to look and see if I can find this thyroid one really quickly before we hop off. Just bear with us just a second. Does anyone have any questions for any of our panelists while we look up the thyroid condition on YouTube? Okay, everyone. Well, thank you so much for coming out. I am, again, still looking for the thyroid video. Who was that needed that? Zeb, was it Zeb that was asking about thyroid? Zeb, if you can do me a favor and send me an email. Send me an email and I'll type it again, yourcbdpharmd@gmail.com. And if you can send me an email stating that you're looking for information around thyroid and how CBD can impact it, then I'll make sure that I forward you that, that video. And Jewel, I see your request. I will certainly send that for you. Nikisha, if you also want to send me an email just reiterating that question so that I can pass it along and begin to work on that with some of our either medical advisory board members, if that's something that I start, I think that's a great idea. So Nikisha, please, please send me an email if you are still here. Also, Galaxy J7, can you send me an email as well with the tinnitus, please? Just so I have all of them in one place and I can respond one by one. And thank you for your remedy, Robin. I'm sure it's gonna help a lot of people. So we have to go over to the 8 p.m. call this evening to talk further about the business, to talk further about the products. We kind of gave you a little sneak peek about how we use the products. But if you have anybody, any guests or anybody that's interested that wants to learn more about the products, if you're a healthcare professional yourself and your interest has been piqued, you want to learn more about how Wakana fits into this space, come over to our 8 p.m. call. We are going to hop over there right now, but I thank you all for your knowledge on this this medical advisory board. I thank the attendees for coming and listening with us and learning with us. And we will see you all at 8. Everyone that needed to email me, please make sure that you do. Please, please, please. Christine, please send me an email as well, yourcbdfarmd@gmail.com. So with that being said, you all have a great evening. Thank you so much, Medical Advisory Board. Robin, you were awesome. Dr.
Thank
Sylvester,
you. So are you.
Kathy, thank you so much for always being on. You all have a great evening.
Good night,
Great
everyone.
information, Queens. Thank you so much.
Thank you, Kathy. Good night, everyone.